Okay, so change of subject now. So we're going to be talking about the emotional and psychological aspects of living with MPNs. And our next speaker is eminently qualified to talk to us about that. So Dr. Lindsay Carpenter, coincidentally also working at Oxford University. Now, she's an expert in patients who live with chronic diseases, okay? And that's what we all have. So I'd like to welcome to the stage Dr. Carpenter. Thank you. Thank you.
Gosh, it's brilliant to be here. Thank you very much for asking me to come along and talk. So I'm Dr. Lindsay Carpenter. I'm a consultant psychiatrist, so I'm a medical doctor who specialises in the interface between mental health and physical health. And I work at Oxford University Hospitals as part of the psychological medicine service. I'm exclusively part of the haematology service there, but also work a little bit with the Macmillan service, which straddles both haematology and oncology. So I was thinking about what to talk about today, and there's so much to talk about, but I thought I'd keep things practical and hopefully useful for everybody. So this is a bit of an overview about what I'm going to talk about, and I'm going to be really mindful of the time, so it will be a bit of a whiz through. Brain versus mind, something that I think about a lot. Specific issues related to MPNs, and general advice about optimising emotional health, and a little bit about what to do if you're worried about any aspect of your mental health. So this chap here on the slide is René Descartes, who's associated with the concept of mind-body dualism. This is how we used to think about mental health, some years ago, that our mental health is not a physical entity and it's completely separate from our physical health. Actually, now we know that that's not the case, and there's been lots of studies over the years, particularly since functional neuroimaging has become a bit more sophisticated, that have shown that psychological experiences have correlates in our brain functioning. So essentially, as I say to people that I see in the clinic, our brain functioning, or our mind, is a manifestation of our brain functioning, which is part of our body, which is all one and the same thing. So an integrated approach to problems is really crucial. But unfortunately, we're very lucky in Oxford that we have an integrated psychological medicine service, and there are some around the country. But most trusts have separate mental and physical health services. And it's very much structured around the dualistic view, which can really not be that helpful, I think. So just a bit of a look at the specific challenges on the emotional side of things that come with MPNs. I did a very unscientific straw poll amongst some haematologists I work with. I actually share an office with a number of the haematologists that work with the MPN service. And so I just asked a few people, what do you think I should talk about? What comes up most in discussions in your clinics? I know what comes up when I see people, but of course I talk to people about their emotional health all the time. So the three things that were mentioned were fatigue, uncertainty, and treatment side effects, such as PEG interferon. I'm going to concentrate really on the first two, but I will make a comment really about PEG interferon at the moment. Obviously, quite a lot of people take that medication. It's a really useful medication, but it does have a significant risk of psychiatric side effects, particularly depression. And so most of the studies that I'm familiar with PEG interferon look at the hepatitis C population. It used to be used very regularly to treat hepatitis C, and I actually used to work in Australia in a hep C clinic for a number of years. And the rates of depression with PEG interferon are quoted around up to 40%, depending on the project that you look at. Bearing in mind that the base rate of depression in people with MPNs is around 25%. So very important to be really aware of your mental health, particularly if you're taking PEG interferon. And if you have any concerns at all, speak to your haematologist who'll be able to direct you in the direction of someone who can assist. So just to really move on to fatigue, it's a really common symptom. So it's the commonest reported symptom, reported in over 80% of people with MPNs. It has a significant effect on your functioning and quality of life. It's often multifactorial. So I'm a psychiatrist. I see, obviously, I'm a medical doctor. I think about medical things, but obviously I'm very interested in the psychosocial side of things. So I look at people broadly, as all of my colleagues do, and try and think about all the different factors that might be prevalent in someone who's struggling with fatigue. There are a few associations that the research has pointed to. Demographic factors, so people who are a bit younger often report more fatigue, women often report more fatigue. There are some lifestyle-related factors. So raised BMI, so if you're very overweight. My anecdotal experience also is people who are quite underweight often have fatigue also. Substances, so I talk to everyone I see about substances, particularly alcohol and obviously illicit substances as well. So they're very important, and alcohol particularly will have an impact on your level of fatigue via a variety of mechanisms. There's an association with a sedentary lifestyle and obviously sleep disturbance. There are other medical factors that are at play as well. So underactive thyroid is probably the classic medical thing that can come up and that can cause significant fatigue. So if you go and see your doctor with the symptom of fatigue, they will often check your thyroid. As a psychiatrist, I'm very interested in depression. I spend quite a lot of my time seeing people with depression, and fatigue is one of the core symptoms of that. And medications as well. So any medication that's what's called a sort of central CNS depressant that can have drowsiness as a side effect. So opiate painkillers, benzodiazepines like Valium, that sort of thing, and sedating antihistamines. So if I see someone with fatigue, I'll often have a look and if they're taking medications like that and have a bit of a think about whether there are any alternatives. Just some thoughts about managing fatigue. As I said, it's multifactorial, so it's often really helpful if you have fatigue just to look at what's going on in your life and look at the various things that you can change slightly. So day-to-day life, having a regular schedule is really helpful. Quite a lot of people I see in my clinic don't have a regular schedule, and that's unhelpful often. So being aware of what your day-to-day activities and tasks are, and scheduling activity for the times of day where you might feel you have a bit more energy. Prioritising, really important. I have primary and early senior school age children, and I constantly harp on to them about prioritising, but doing what's most important first, then you know that's done. Using labour-saving devices. There's lots of stuff around that can help, including those little sort of robot vacuum cleaners that do your vacuuming for you. Things like that can be really useful. And delegating, so telling other people, or asking other people, obviously, to help out and do things that you might not be feeling up to on that particular day. Lifestyle modifications. Obviously, Susie's spoken quite a bit about lifestyle and cardiovascular risk factors, so I'm going to talk briefly about the same thing, because there's lots of research that shows that that's really helpful in managing fatigue, but also managing mood as well. So exercise, obviously picking an exercise that's helpful for you, that you're going to enjoy, that's easy to fit in with your lifestyle. Weight management, so having a body mass index within the healthy range, which is usually 20 to 25. Addressing drinking and smoking, so trying to keep your drinking within the safe limits. I think since I've been a doctor, I think the safe limits have sort of dropped a bit. I think 14 units a week is the current safe limit of drinking, but trying to keep it well under that's really helpful. Smoking as well is a really key cardiovascular risk factor to address. Diet and fluid intake, so just trying to have a healthy diet, which is really helpful for all of us. Looking at your fluid intake, if you know that you need to pass urine overnight. Speaking of which, I've just spilled my water. Talking about fluids, apologies to the cleaners, but anyway. So if you know you're going to pass urine overnight, maybe looking at fluid intake during the day. Put caffeine in brackets as well. Caffeinated drinks are obviously stimulants. And if you're particularly sensitive to caffeine, making sure you don't drink caffeinated drinks later in the day. I did a phone review on somebody on Thursday who told me that he drinks 10 litres of caffeinated Coke a day, and not surprisingly, he doesn't sleep very well. We talked a little bit about what he might do for that, but hopefully he can make some changes. Obviously, optimising medical conditions like hypothyroidism and managing depression if that's a problem for you. Just a bit about managing uncertainty as well. Obviously, having an MPN can cause negative emotional states such as anxiety and distress, and can also affect relationships, study and work. Now, I'm a psychiatrist. Psychiatrists are interested in mental illness, but psychological symptoms are obviously very important as well, and negative psychological states such as anxiety and distress and things like demoralisation can have a really significant impact on people's quality of life. So tips to manage uncertainty. I'm probably preaching to the converted speaking here, but learning about your condition and the various treatment options and just being educated about what you're going through and what sorts of things can help. This also really promotes good communication with your treating team, and that's really key, very important in shared decision making. That's a key sort of term that we use in health nowadays, and I was actually talking to one of the presenters yesterday about shared decision making, which we sort of both agree probably isn't really very realistic when we're looking at how we work in the clinic, because actually the decision makers are you. We're just there to provide you with information and to help you make an informed decision. But knowing about your condition obviously promotes good communication and enables you to make the choices that are right for you. Also enables you to know what to expect and to help you feel in control and plan things. Telling loved ones how you feel can be important and can be really useful. It can help with coping and feeling supported. I put be selective with that, and actually one of the things that one of my haematology colleagues mentioned was telling people, particularly work, actually, whether you have an MPN. And I will say, really to this group, what I say to people who I see in my clinic, that's your personal health information, and it's private for you. So think about telling people on a sort of a need-to-know basis, really. Do you need to tell work? What's your employer like? How is your MPN going to affect your role? It depends on your job and the hours that you work and your tasks at work. You may have a really brilliant employee who's really supportive, in which case it can be really useful telling them. Alternatively, it might not be. So have a really, really good think about whether you want to tell your employer, whether that would be helpful. Obviously, everyone's going to have individual circumstances. Joining a support group or chat room, obviously the MPN voice is brilliant, so it's a great area of support and peer support, particularly in managing uncertainty. I put living mindfully as well. There's lots of information out there about mindfulness, which is a really useful way of managing difficult emotional states like stress. If anyone has children, children often learn mindfulness techniques in school. So things like meditation and mindfulness activities can be really helpful. Some people find them really useful, other people find them really hard. I have to say I'm one of those people that find meditation, it's just impossible. I just can't quiet my mind enough to do it. But we can live mindfully, which is really very useful. And what that basically means is being in the present. So it means that your mind's not tied up with worrying about what might happen in the future or ruminating over things that have happened in the past, but being in the moment and being alert to what's happening around you. So we can actually live mindfully without actually using overt mindfulness or meditation techniques. So I've put hobbies down there, and I was thinking about what sort of hobbies promote living mindfully. And I think anything that requires a bit of skill or a bit of learning and some concentration is really, really good. So I'm a swimmer. I like to swim. Obviously, we all like to get better at something that we don't think we're very good at. So thinking about, when you're swimming, thinking about strokes, things like yoga, tai chi, racket sports, things like craft activities that require you to really concentrate on what you're doing and being in the present, playing musical instruments, anything that involves learning and thinking about what you're doing is a really good way to just be mindful, and that can help to get all the noise out of your mind. Distraction. I think distraction can be a little bit underrated, and I talk about distraction with people that I see. Obviously, if we're having difficulties, repressing things and not addressing them is not helpful, but just putting them aside for the moment, if you're having a particularly difficult day, can be useful. So using a distraction technique can help you in the moment. So getting completely absorbed in a film or a book or a piece of music can be really helpful at that time for you. And planning events, short-term events, planning for a coffee with a friend, or you're going to see a film that you're really looking forward to in the next week, can also help just to kind of ground you a little bit too and have something to look forward to. Just some general advice. I've been harping on about optimising lifestyle and exercise. I won't say any more about it, really. Very important. Nurturing relationships as well. Humans are social creatures, and we have relationships with people who are important to us, and that's really, really helpful. Obviously, nurturing relationships with our treating team. I've put a bit further down the list. Engage with your team. I've been working in general hospital psychiatry for about 23 years now, and I've worked with a variety of teams over the years. And my experience of working with haematology, which has been for the last 3 years, has been, without exception, all the staff with the haematology service are really good at providing psychosocial support for people that they see. It's part of their day-to-day job. They're excellent at it, so engage with your team and talk to them, let them know how you're feeling. Purposeful activity as well, managing emotions, self-esteem. That may be paid employment, that might be something else actually. Voluntary work, really useful. Or just doing something that you find really fulfilling and really helpful. And knowing when to ask for help as well, which is really important, which I will just move on to. So when to be concerned about your mental health. Psychological symptoms is really just a term that describes our emotional states, really, including positive emotional states as well. But negative emotional states can be problematic for everybody at times. When those negative or difficult emotional states become persistent over a number of weeks, and when they pervade all aspects of your life and affect your functioning, that's when I, as a psychiatrist, start to think about whether someone has a mental illness or not, or a mental disorder. Mental disorders or illnesses, they are treatable, and there are lots of treatments out there, both medication options and non-medication options. Obviously, as a psychiatrist, I do prescribe various types of medications, but also there are a lot of non-medication options that are available, such as talking therapies with a variety of services, including clinical psychologists, most of whom are absolutely brilliant at providing the really brilliant evidence-based talking therapies that are helpful for things like depression and anxiety disorders. Where to go for help? Obviously, specific charities are useful. MPN Voice, obviously, why we're all here. Blood Cancer UK and the other specific charities that can be helpful. There are general charities such as Macmillan's and Maggie Centres that can be useful too. Your treating team, a really important source of support and advice about what to do next. They'll obviously be aware of your local services and where you can access support. Liaison psychiatry or psychological medicine. Most trusts will have some form of those services, and it may well be appropriate to be seen by the members of those teams within your trust, and your treating team would be able to point you in their direction if they think it's required. Your GP, very important. A bit of a disclaimer, I trained as a GP originally, and I think GPs do the bulk of psychological care in the community, and many of them are brilliant at it. NHS psychological therapies providers, all the different counties used to have slightly different names actually for their psychological services providers. My understanding is now that they're now all very helpfully called the name of your county and talking therapies. So if ever you're interested in seeking some psychological treatment from trained therapists and clinical psychologists, you can actually self-refer. So just Google your county and talking therapies, and that will come up, and each site has an electronic form that you can fill in, or your GP can refer you. Obviously, if you have significant struggles with mental illness, there are local community mental health teams too, and local crisis services as well. And obviously, I haven't put that down there, but I talk to people very regularly about services such as Samaritans and Shout as well, which are really great organisations that are 24-hour support lines. And I think that's it. I'm just about on time, I think.